Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Good morning, everyone. Welcome to another episode of the Dental Brief. I'm excited today for our guest. We have with us someone who practiced dentistry and who now is helping dentists all over the country. Dr. Ginger Bratzel, say good morning.
Hey, thanks for having me on. I didn't ask if you guys call yourself the Dental Briefers. I think you guys should. This is such a good podcast. You should have a name for your audience, but I appreciate you guys having me on.
You know what? I've never thought about having a name for the audience, and that's a pretty good idea. What do you think we should call them?
Well, I was sitting there. I was trying to give you a nickname, but I don't. You embrace the brief in that picture, and I don't.
Yeah, you do.
and I'm like, you go for it. So I'm like, it's got to be something with underwear. It's got to.
Yeah, I think that's. I love that. Or actually, I love the logo that one of our designers created. I think it's fun. It's fantastic. And obviously, the Dental Brief has multiple meanings, and I think we have so many. Our listeners are from all walks of life and dentistry too. So, it'd be fun to come up with something. So maybe we should have a contest. Thanks for bringing that up. So glad to have you here today. What I want to do is what we do with most guests. Talk to me about how you became a dentist. How did you get into dentistry?
Well, I always wanted to be a dentist. That was the only thing I did want to be, and, never changed that course. And so I was on the fast path to do that. And so when I was getting done with dental school, I knew I wanted to go back to my hometown in New Mexico. I went to University of Colorado. And when a practice came available, I approached the dentist, like most young dentists do. And we worked out a deal. When I went ahead and bought the practice while I was finishing up dental school. So I left him there. He was going to take care of matters and everything like that. And, going into the practice, you do full discovery, you do all those good things. And it had some problems. But, I was like a lot of people, naive with my shiny new dental degree. And I was going to go out and conquer the world. And it was just, I needed him out of there, and I could take over. And I found out very quickly, it wasn't just him that was a problem. There was a lot of broken systems in the office and things like that. So I spent a lot of time and effort in figuring out the systems and going through. And, I looked to my friends in dentistry, and they'd say, you have to pay your dues. There's nothing you can do about it. You just have to pay your dues. And they told me I had to pay for dues for 7 years. And I really expected on that 7 years and one day to wake up and all my problems be gone.
Sure.
And it wasn't. And I was going about building my practice the wrong way. A lot of overhead. I was bringing a lot of toys, tech, getting a lot of initials after my name. And I never put the focus where I should have really put it. And that's what I find what most dentists do. They want to serve patients, but they don't really communicate with patients and everything that goes with it. So, when I say marketing is any communication with a patient. And when we switched that, things changed really, really fast. And I didn't realize what a difference it made until I got a call one day from my accountant, who never called in the middle of the day and said he had to talk to me right away, which scared the bejesus out of me. And I went back to the office and picked up my phone, and he told me, I'm in your QuickBooks and there's a problem and I can't find it and you need to help me. And I asked, well, what's the problem? And he said, well, someone's made a data entry in there, and it's not just one day, because that'd be easy to find. It's multiple days. There is too much money in your account. And when I chuckled, and he said, what's going on? And I said, I'm sorry, no, there's no problem. We're just doing a lot better. And he said, tell me what that means. And so I told him what we were doing different and going through it. And he was real quiet, and I thought I was in trouble still. And I came back and he said, do you think this can work for somebody else? And I said, yeah. He said, there's nothing unique to your town or some new technique that only you can do and nobody else can do. And I'm like, no. And he said, okay, because I need to call some other clients, 3 of them that have been practicing together for a long time. They're not doing really good. And we're going to have a hard conversation. Could I give them your number, and can you show them exactly what you did in your practice and help them do that? And that's how I started that venture when I was just doing something for myself to make it better, to helping others doing that.
Yeah, so I think that's fantastic how you made that leap, right? It's always kind of accidental, or it seems accidental at the time, or when we look back on it. And talking about the problems that you had in your practice, we're here today because all practices have problems.
Right.
And, so that's a given. The practices who don't think they have problems are probably the ones that have the most amount of problems. or the worst problem of all. So
Denial.
yeah, so clearly you made a leap from, running a successful practice, turning a practice around, running a successful practice. What was that? What was it that you were doing? What turned things around in your practice? And how are you helping other dentists with that same issue today?
Well, I was putting the emphasis on the dentistry, and dentistry is not what we sell. We sell relationships. And I was so worried about telling them about how great this machine was and trying to tell about this great, or I had this new course that we've done, and we have these new materials. And what they were looking for is, hey, how can you get me out of this situation? How can you make me comfortable? How can I afford this? Is it worth it? Has somebody else been through it and thought it was worth it? And how are you going to take care of me? And, and how are you going to make it work with my schedule? And those are real human problems that they had. I was always trying to teach them how to be a dentist and go through and explain, let me draw a picture of a root canal, why you need it. They didn't care. They wanted to do that. They'd been a dentist. What they wanted to know is you're going to make me feel better and take that through. And so, it came back to speaking their language and talking it. We had some clients, we did a research study kind of on this. What do patients want to hear? So in their office, they were trying to get more dental emergencies, and they kept advertising for dental emergencies. They were doing, all these hours. They were doing all these different things, just trying to bring people in for dental emergencies, and nobody would come. And they said, I don't think anyone's interested. We all know people have dental emergencies. So we got on a mommy forum because we knew moms made most of the decision. We put one of the staff members on there just as a common person. And she said, I work in a dental office. What things make you choose a dentist and not choose a dentist? So when we broke that down and started looking at what they were saying, when it came back to dental emergencies, nobody called it that. They called it a bad tooth. So if you think of the psychology on that, it's really important, because dental emergency means I did something or something happened to me. So if I wasn't in a car wreck and somebody hit me in the face, I neglected something, it puts a lot of stress on me. But if my tooth went bad, it's just a rogue tooth. It takes all the pressure off of me. And so, when we changed all the marketing, said, you got a bad tooth, all of a sudden that dental emergency, and they were getting so many new patients and building up because they were speaking that language. And we have a translation. We go through dental school. They teach us all the terms and we can't shake them. We're talking about cavities and crowns and pulps and gingivitis, periodontitis. The patients don't talk about that.
Right. So what are some of the things that we can replace this with? And let's kind of shift gears on our subject here. What are some common things, like you said, Paul, what are some things that dentists say? Give me 3, 4, 5 examples of things that they say and what they should actually say instead. So dental emergency, bad tooth, what are some other examples?
Well, everyone uses the phrase crown. We like crowns because that's what we're taught. Mm-hmm. Well, they don't know what a crown is. They'll say a cap sometimes, but they don't even know what that is to go over. We'll spend an hour telling someone they got periodontal disease, and they'll say, but do I have any cavities? It didn't get through to them. Right. And so, we've got to come back to and finding what their irritants are. So if their gums are bleeding, they don't even think about that. They said, you got a spot here, you get tasting stuff here. We've got to be talking to them at the level of Homer Simpson. That's what I was always taught in marketing. If you're too technical, if Homer couldn't understand what you said, then you need to find a replacement. And I find a lot of times this is a great exercise for team members. So let's say your office meeting, you go through and put down every procedure you do, and then have a team member trying to figure out how someone else would say it. Break it down to the simplest things. But again, listening, watching, being a spy on the wall, like the mommy blogs. God gave us ears, 2 ears and 1 mouth. We need to use in that proportion. So we need to look and listen and just really find out what's going on, and not trying to correct people and try to push them into that terminology that we learned. And we'd get killed if we said in a clinical setting from a professor.
Yeah, that makes a lot of sense. And, I talked to, maybe you can speak to this a little bit too. I talked to practices about talking about the outcomes too, not so much on how you're going to get there, but why you're going to get there and what that's going to do for you. And I'm kind of giving an example. Mm-hmm. I think I've actually brought this up on the show before. When you're a 46-year-old guy, getting a new HVAC system in your home is pretty exciting. And when I was looking for them, they didn't talk about, they would throw out words like BTU, And
You don't
there's
know
some,
what that is.
and I actually know what that is, and but most people don't.
Right.
But the ones that really talked to, I noticed that the ones that talked about used words like comfort, right? It's the most comfortable system.
Lower bills.
Yeah, right. So they
Quieter
talked about
system.
saving money over time, paying for itself, right? They brought some type of emotion and also some type of result. Like, what's the end result? What is this going to do for me? Not what is it, but what is it going to do for me? Made a world of difference. So, tell me right now, and we can run a little bit long here. I'm fine with that. What are some of the calls that you're getting right now from dentists? So when people are looking for help and they're looking for your service, what's the most common call that you've gotten, let's say, in the last 3 to 9 months?
90% of the time they reach out and say, I need more new patients. And
Okay.
so I call it the question within the question. So
Sure.
that's what they're Google searching. That's what they asked about. That's what they call up and say, I need more new patients. And so, just like being a mom and talking to kids, there's the question within the question. I'm saying, why do you need new patients? Well, because I need them. Well, tell me why. Well, we find out your schedule's light, or you're not producing, or conversions down. And so, when we look at business, it's a math game. So if they think they need 100 new patients a month, I got to figure out why. Is it because we've got 200 leaving out the back door, so we're not retaining patients? Is our conversion so low? So if they improved case conversion just 10%, which is not hard to do, they would not need as many new patients. That's one thing. And then I look at the size of the cases they're presenting. Are they going so high that everyone's not accepting? Or are they going, they'll tell me, oh, everyone accepts my treatment. Then I say, you're not presenting everything they need.
That's
So
right. Yeah.
if you got to break it into a math game. So I look at that and say, yeah, we can talk about new patients, and everyone needs new patients. People move away. They, unfortunately, people pass away. They age out. There's different things that go on. You've got to have a certain flow. But for most people, if they want to increase their revenues and the production, they got to get more people back in. Right. And so that's where I call it the quickest path to the cash. You need to, if I'm looking at somebody as a new client, we're going to start plugging those holes first before I waste any of their time, energy, and money on anything to bring new patients in.
Sure. What's another common call that you're getting right now?
The stunt after COVID, like trying to bounce back. And, we're in a really important time. This is not just for dentistry. We work with other service-based businesses. This is where you have to serve. People have been isolated for a long time, and those relationships are kind of weakened. They put up with a certain amount of BS in your operations, but they have a choice to come out of the cave again, and they want it in a relationship based. And so that's going to be more important than ever. We want to connect with people we know, like, and trust. And, dentists are really great people. I have not met a dentist who's not a caring individual, but that doesn't always come across to the prospective person. They were putting all this energy and effort in building this business because they want to serve more people, but that doesn't translate on the gut level to the prospective patient. So getting that connection back in there. And so, we talk about how can we do more outreach? How can we be more personalized? And then do it as a system so it's not so time consuming. If you want to look at growing a business right now, you got to pull up people that need treatment done, who were knocked off, and see how you can do it. We start with the people we have a relationship with and build it. And I think the best way, we talk about hygiene. A lot of times the client's hygiene's low. I said, if the hygienist is not busy, then have her or him, and I can say that because I have a husband that's a hygienist, pick up the phone, and they're not seeing a patient, call patients that haven't been in. Get in contact with them, reestablish that relationship. Sure. Even if they have a huge treatment plan to still get done, let's them get back in hygiene and let's rebuild that relationship. We've got some recovery to do.
Yeah, I think that's a good point. I think a lot of people that do have a pretty significant case out there, a lot of times don't want to come back in from hygiene because they don't want to be told that they should do it again, or they're embarrassed that they didn't do it, or what have you. So I think that's some fantastic advice. One last question for you today. You have experience in consulting and coaching and working with practices, and obviously you're also a dentist. Give us a couple of tips on vetting someone if you're looking for help in these areas that we've been talking about today, or any of these problems that exist in practices, tell me, how do you go about, what's the best way to find and vet an expert to help you get where you want to go?
I think that's a fantastic question. And I mean, people will go off a reputation. They might go after big names and things like that. If that's important to you, then that's what you choose. But more importantly, I think you need to have, again, back to that relationship. Would you pick a dentist that you couldn't stand to be working with you? And so, when you have a relationship with that person, so, first it starts with a conversation.
Sure.
And a lot of things you can talk, if you see a video on somebody, you can't stand the way they talk or the way their mouth moves, that's probably not going to be a good relationship for you if you don't resonate with that. So meeting someone, it can be virtually at first, and just talking about what's going on and feeling comfortable with that. But part of this too, I think this is coaching right now with anybody. If you don't feel a little bit challenged in that conversation and feel like, I'm a little bit scared, and not in a bad way, just like butterflies in your stomach, then they're not going to take you far enough.
Sure.
Their job is to coach you. They are to get more out of you than you thought you could do. And if they believe in you, they will do that and make that happen.
Yeah, definitely got to make you uncomfortable. I agree with you 100% there. Dr. Bratzel, so thank you. I want to thank you again for coming back on the program. We're very appreciative of having you here today, and I'm sure our audience is too. I want to encourage our guests to check out our audience to check out your website. It's gingerbratzel.com. It's Ginger Bratzel, BRATZEL.com. Thank you again for coming on. We appreciate it.
Thank you guys for having me, and I appreciate being brief.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.